Hello, everyone, and welcome back to the CLSR. And I'm your host, the counselor. And today we're going to talk about a rather serious subject that I'm actually discovering it affects men and women. But we're going to stick with the men right now because it is rather serious and they do need their dedicated time. Male pattern baldness. I said it. Male pattern baldness. And it's just, I don't know. It seems like they've got all these different treatments. However, I've never seen a good wig on a man. I mean, I don't know. It's just something that's commonplace now. And what is that? Male pattern baldness. It's called androgenic alopecia. And this is the most common type of hair loss in men, right? 50% of all men over the age of 50 will be affected by male pattern baldness to some extent in one way or another. 50, I said it, 50% of men experience male pattern baldness over the age of 50. And what is it? What is causing this thing? It's everywhere. I mean, 50%. The numbers are definitely higher over the age of 50, which could be understandable. However, I think one of the issues is when you're younger and you start to have it, right? So, for those young men who might be experiencing this anxiety because of it, I think we need to understand a little bit of it, right? Because there are people going out of their way, um, and they're feeling really bad about themselves because of this male pattern baldness and its causes. And one of the causes of male pattern baldness is genetics. We're having a family history of baldness. Look in your family. If you had an uncle, doesn't necessarily mean your father, but if your uncle or someone in your family has male pattern baldness, it usually it's associated with a family member in your family. It could be genetic, and usually it's associated with hormones, sex hormones called androgens. And these androgens have many functions, and you know the main function is regulating hair growth. See, we do need to understand that each hair on our head has a growth cycle. And with this male pattern baldness, this growth cycle has a tendency to weaken, and the hair follicles shrink, producing shorter and finer strands of hair. Eventually, the growth cycle of each hair ends, and there are no new hairs to grow in place. And if it's inherited male pattern baldness, usually this has no side effects. However, there are sometimes side effects, right? There are some cases that it's more severe, and it actually causes certain cancers, right? And you need medications and thyroid conditions and anabolic steroids, right? So you do need to see your doctor if you do have some hair loss or after taking medication, because medications, if you take some, it could cause some male pattern baldness, right? Especially when it's combined with other health complaints. Usually the doctors use this, there's a pattern that they use for hair loss to diagnose male pattern baldness, right? They will perform a medical history exam on you to rule out like certain health conditions that you may have experienced or that are causing this male pattern baldness. Could be fungal conditions of the scalp or nutritional disorders, right? Health conditions can cause male pattern baldness, especially when a rash of redness and pain, feeling of the scalp, the hair breakage, patchy hair loss. This is an unusual pattern of hair loss accompanied by the hair loss, right? And sometimes they have to do a skin biopsy and blood tests. And this could sometimes be necessary to diagnose the disorders responsible for the hair loss. So, who is at risk of the male pattern baldness or even at this hair loss in general? Well, it really can begin in those early stages. in those teenage years. But it's more common in adult men, but it can start in those teenage years. And it increases through the ages, right? And genetics do play a big role. Men who have close relatives with male pattern baldness are at a higher risk, right? Especially when these relatives are on the maternal side of the family, right? When they're connected to you directly. And some of you ask yourself, are you losing hair? If your hair loss begins at the temples or the crown of the head, you may have male pattern baldness, right? Some do get a single spot, a bald spot. Others experience their hairlines receding from a M shape, and the hairline will continue to recede until all or most of it is gone, right? And man, that could be devastating. And what do you do about it? Right? People, especially young men, they panic because a lot of those young men out there, especially in their teenage years, a lot of it is about their appearances, right? How they appear to others. So there are treatments that are out there, and I think many of us see those treatments on television, and we have a tendency to believe that they're not really working because they've been there for years and people are still losing hair. So we really didn't figure out the cure. In actuality, there are no real cures, despite what they tell you on television. Medical treatment might not be necessary if there are no health conditions present. However, there are treatments that are on the market. So if you are unhappy and you need to have a full head of hair, there are certain things that you can do. One is your hairstyle, right? If you have limited hair loss, you can sometimes hide it, right? With the right haircut or hairstyle, or ask your stylist for a creative cut. That'll make thinning hair look fuller. I've seen people go for hair styling just to manage their hair loss. Alternatively, there are wigs or hair pieces, and these wigs can cover the thinning hair, receding hairlines, or complete baldness. They come in a variety of styles, colors, textures. However, what you're looking for is that natural look. So you choose wig colors, styles, and textures that look similar to your original hair, right? Professional wig stylists can help style and fit wigs for an even more natural look. They're work though. Wigs are work. Wigs take some work. You can't have a stylist with you when you come out that shower. So remember that there's some work, and you usually can catch somebody catching a wig. You know, and if they're wearing wigs, usually you can detect because after a while they look ruffled like you've been playing in the jungle, right? You got to keep a wig up. You got to take care of your wigs, right? Wigs need water too, so you got to wash them. You can't just have a wig where you're wearing a wig and not taking care of it. You got to take care of it. It's almost like having a pet. You got to keep it clean, keep it trimmed, right? Make sure it's looking good on you. You got to take care of it. As if I'd have to even go as far as to say, take care of that wig like you would your own hair if you had it. And weaves, hair weaves, they're wigs. They're sewn into your natural hair. However, the thing is, you must have enough hair to sew into, right? And the advantage is when you're using weaves, they always stay on, right? Even during activities such as swimming, showering, sleeping, those are good. There are disadvantages though when it comes to weaves, right? Right? They must be sewn again whenever new hair grows. So if you have hair on your head, especially the hair around your ears, and it continues to grow, right? And you got some weave connected to it, you got to trim it up and keep connecting, right? You got to maintain it. Women know all about this. Women who use weaves and wigs. So if you're a man that you can get away with some weaving, then go to one of those shops, right? And get them to take care of it. But just make sure you know it's a process. It's not a one-shot remedy, right? So what are people using? Some of these ointments out there. You heard about the Rogaine. Well, be careful with Rogaine because you might get a migraine, right? Because Rogaine sprays right on the head. Another name for Rogaine, minoxidil, is a topical medication applied to the scalp. Minoxidil slows hair loss, they say. Like, I don't know what that's all about. I don't think it's worked. Seen some Rogaine. I haven't seen no gain from Rogaine. I seen a lot of people spending their money, but also remember you're spraying something into your brain through your scalp. Your scalp's porous. People don't really take that into consideration. You know, Rogaine might give you a migraine. So minoxidil is supposed to slow hair loss for some men and stimulate the hair follicles to grow new hair. That's what it's supposed to do, right? And it says on the package, and the time frame could be from 4 months up to a year to produce some visible results. And hair loss often happens again when you stop taking this medication. That's the only thing. What is that? And there are side effects associated with minoxidil, which is dryness, irritation, burning, right? Scaling of the scalp when the scalp's all dried up. You should visit your doctor if you have any serious side effects from um, Rogaine. But I recommend strongly that you just stop using it right away, right? It could be weight gain, swelling of the face, hands, ankles, and abdomen, trouble breathing when lying down, rapid heartbeat, chest pain, labored respiration. Oh, you're going to punish yourself for some hair. Like, what? That is a lot to deal with. So, putting those chemicals on your brain, right? Spraying it into your scalp, rubbing it in, it has some serious side effects. And you know what? It doesn't bother people who want to keep their hair. They're like, I'd rather be dead than and beautiful than alive and ugly, right? Like, it just really depends on the person. But the truth is, we put ourselves through. It's just been amazing. Like, I used to be surprised, but not in 2020. You can't be surprised anymore. People are doing some things. Butt, left, chest. Like, I actually heard, and I was sitting up there and they were talking about headaches, and I heard them say that they are actually giving Botox injections to people who have headaches. Like, this is the stuff that they used to use in people's faces as fillers when they wanted to have like a facelift, but they're using Botox injections for migraine. Just think of that going in your brain. People are losing it, but it's happening. But there are possible side effects, and I told you it's probably worse than that as well. Think about if it's going in your brain, you know, does it affect your mood? Whatever. The point is, you are spraying something into your brain, and it's only temporary. So if you stop using it, it stops working, and it's not cheap. So you got to think about it. Finasteride, Propecia, or Proscar. Finasteride is an oral medication that slows hair loss in some men. It works by blocking of the male hormone responsible for hair loss. Finasteride has a higher success rate than minoxidil or Rogaine. So when you stop taking finasteride, your hair loss returns. However, you must take finasteride for 3 months to 1 year before you see results. If there is no hair growth after a year, your doctor will likely recommend that you stop taking the medication. There are side effects as well with this oral medication, and they could include depression, severe itching, rashes. You're going to have hives possibly, and breast tenderness, breast growth, swelling of the face or lips, painful ejaculation, pain in your testicles, difficulty getting an erection. What? I'm scared. And there's people out there that will do it. It doesn't matter what I just told you about. People will do it. They don't care. They want their hair, right? They are going to do it. They'll go through all these things regardless because appearances matter to more people than you care to believe. And when you think about the tenderness of the breast or the swelling of the face or lips, you know something's messing with the hormones. However, people will go to any extent to get their needs met. Although it is rare, though, finasteride can cause breast cancer. That's what a lot of people don't know. So if you're having breast pain or lumps, you got to be evaluated immediately by your doctor. And it also can cause problems when it comes to your prostate. And men who have prostate cancer have to be careful because there's a drug that you take to test prostate cancer, and this finasteride, it actually creates false readings, or it presents issues when it comes to getting clear tests about your prostate. So you don't want to mess with it because the prostate specific antigen, which are tests used to screen prostate cancer, could be affected by finasteride. So keep this in mind. Also, there's guys that, when they're dealing with male pattern baldness, they end up trying hair transplants. And hair transplants can really work for a lot of people. It's actually the most invasive and expensive treatment for hair loss. And how it works is these hair transplants work by removing hair from areas of the scalp that have active hair growth and transplanting them to the thinner and balding areas of your scalp. So, when you see a man and he has hair going all around his ears, to the back of his head, all the way around to his other ears, um, basically, they take that hair and they transplant it into the bald area, right? And it requires multiple treatments. And the procedures carries a risk, though, of scarring. Because obviously, if you have to cut out those hairs, so you cut out, let's say, if you cut out a strip of hair from that growth, it's gonna what? Scar, because it's got to be sewn up. It's almost like they're cutting out. Think of it like grass. And you ever see those rolls of grass that people apply to the lawn? Well, it's the same thing. It's like cutting that out of that hair section of your head. Once they remove an area of hair, like a patch of hair, then they will cut out the little hairs out of that patch and replant them into your scalp in the pores that are available. Now, this is an entire process that, if you're not aware of it, you have to really understand this procedure, and it does carry risk of scarring. So when you do that, you can only be scarred. You can catch an infection, but there are advantages to the hair transplant. It looks more natural and it's permanent. Now, just to let you know, I've seen men with it, and yeah, it looks better than what they had before, but sometimes it doesn't look so good, as with anything, right? Get the wrong doctor and you gonna look like a fool. But the truth is that it costs a lot of money. It does. It costs a lot of money. And if you have a lot of money, you can get a lot of hair. But you really have to consult a professional who's well experienced, because it could do more damage than good. So, um, just understand that people who do go bald, a lot of times they don't talk to anyone about it, but they do need to. They should be getting some counseling if they're going bald, because it can be a big change in their lives. And quite simply, they can have difficulty accepting their appearance. So, there's a reason for seeking counseling, because there's going to be some anxiety, some low self esteem, possible depression, or some other emotional problems because of this male pattern baldness. It does impact men for sure, and women. But yeah. And you got to ask yourself, with all these years and all these treatments, um, can hair loss be prevented? And I'll tell you the truth, there really is no known way to prevent male pattern baldness, right? There's a theory out there that it's about stress causing hair loss, right? By increasing the production level of sex hormones in the body. However, you can reduce your stress by participating in relaxing activities, walking, listening to music, meditation, enjoying some quiet time. However, there really is no real cure. However, there are things you can do. There are men out there who do seek laser treatment, and what this does is reduces the inflammation in follicles that keeps them from regrowing. So, and however, the studies are very limited in their effectiveness for treating hair loss. And you got to consider that you might have to do some lifestyle changes to help your hair loss, or limit it. Anyways, like quit smoking. If you're a smoker, you probably heard about the negative effects on you, on your lungs. However, it could cause some hair loss, right? Facial wrinkles and premature graying of hair, right? There is a link between smoking, according to research, and hair loss. And to prevent this, it might be a good idea to quit smoking. Be a good idea to quit smoking anyway. But scalp massage, that also um, helps the scalp, right? It makes you feel wonderful, but it can help with the hair loss. Massaging the scalp stimulates the follicles, right? And a balanced diet. If you have a well balanced diet, this can keep your hair in tip top shape. Make sure you're including a variety of vegetables, fruits, whole grains, unsaturated fats, some lean proteins in your diet, and limit those sweets. A lot of you love the sweets, but watch that. There are certain vitamins and minerals found in food that are associated with healthy hair, right? So try adding iron rich foods to your diet, like lean beef, beans, leafy leafy vegetables, iron fortified grains and eggs, foods that are rich in omega 3 fatty acids, such as salmon, mackerel, tuna, flax seeds, even some egg yolks, hemp seeds, and walnuts. And try to get some high protein foods like eggs, lean meats, and seafood. Make sure you're drinking lots of water. And some people have male pattern baldness because of the genetics. However, there are other health conditions that can result in hair loss. And this could include diabetes, lupus, alopecia areata, thyroid conditions. If you have a eating disorder due to poor nutrition, iron deficiency, anemia, hair pulling disorder known as trichotillomania, and syphilis. That also impacts the hair. So if you do have any of these conditions or you're experiencing some of these symptoms besides the hair loss, you have to talk with your doctor. You got to get some treatment. And when you do get some sort of treatment, it is going to improve your condition. And try to reduce your stress. If you're in a job that's super stressful, try to limit that amount of stress. It's good for you because it can do a number on you, especially your hair. Because hair loss is related to stressful lifestyles, and you can do things to reduce stress, like listen to music, exercise, yoga, meditation. And there are alternatives too for this hair loss, this male pattern baldness. There's alternative treatments, there's oils. And some people say that there's peppermint oil that can help with hair growth. Rosemary oil is also supposed to be good traditionally to increase the blood circulation in the scalp. Coconut oil or castor oil and even olive oil are widely recommended, right? But the research doesn't support it so much, but right? Saw palmetto. This is a plant which has small berries that are often used as part of a treatment plan for an enlarged prostate, which, you know, saw palmetto's ability to treat hair loss did show some positive indicators in one of the research studies that I read. But there's biotin. This is a vitamin found naturally in foods like nuts, sweet potatoes, eggs, onions, oats. It's important that biotin supplements are monitored, but they're taken by mouth and they may slow the hair loss. Right? It's not necessarily going to prevent it, it's just going to slow it down. And onion juice. There has been a study out there that I read that said onion juice as a topical treatment resulted in significantly more regrowth than just tap water in people. Bringraj, a species from the sunflower family, is also known to support hair growth. It's an herb, right? The extracts from this herb do show better hair regrowth than minoxidil Rogaine. But there is some much more needed research on this Bringraj. And green tea, right? People say hair loss and green tea. Green tea does help. Hibiscus, Rosa sinensis, is marketed widely in India for hair growth. Shows positive effects on hair follicles. but there actually hasn't even really been any hair studies on humans in regards to hibiscus. No real studies that come out with anything promising. And you just got to be gentle with your hair. If you do have some hair, be gentle with it. We got these combs that they invented, and some of you go crazy with the combs. And that comb's pulling some of your hair out. So you got to be careful. You know, that's something that people don't think about. They spend their whole lives combing their hair where it's rough, tough. Next thing you know, part of it's going down. You've been pulling at it. It's coming out. So you got to be careful. You don't take things for granted. Try to be as gentle as possible when brushing or styling your hair. Constantly twisting or twirling or pulling, right? Right? Picking it out too much, pushing it backwards, right? This could lead to hair loss. There's certain things that you need to avoid if you're going to limit the amount of hair loss that you have on your head, right? Like those tight hairstyles, such as pigtails, cornrows, braids, and buns. It doesn't work for everyone. Some people don't have them strong roots. But if you're tying them up, pulling them up, and you start to see that your hairline's backing up, maybe your hair's too tight. Hot oil treatments. Be careful with the hot oil, right? You could be killing your hair follicles in your head. The hot oil treatments, right? Chemicals that people use for the perms and the hair straightening treatments. People do that. I mean, back in the early 90s, what was it called? Jerry curl or S curl, where you come up with like 5 different things to put in your hair, these topical treatments. I'm sure some of my former colleagues wish they didn't do that. They didn't put all those chemicals in their hair, right? But if you must use chemicals or bleach in your hair, you got to get it from a trained professional. Do not try to do it yourself. That was something that they did themselves, but today, use a professional. There's a lot of people that know how to use the topicals on your head, right? And if you find that you're losing your hair, um, it's not going to be easy, but there are medications that do cause some hair loss, like chemotherapy and radiation treatments. And if you're getting blood thinners or you're taking blood thinners, right? Anticoagulants, and coagulants, what they do is they stop the blood from clotting, right? A lot of people who are older use that, just keep the blood flowing, right? And there's drugs that people take to prevent depression as well. Medication used to treat high blood pressure can cause hair loss. Heart medications, gout medications, Accutane and acne treatment. And I'm telling the young people, be careful when you're using Accutane, right? So if you are concerned about some hair loss, don't stop taking the medication right away. See your doctor first, right? You might just have to wait, but you got to see a doctor, especially if you're experiencing sudden patchy hair loss, or if you think a medication may be causing you hair loss. And if you do get some rashes or some scaly skin, as I mentioned earlier, go see your physician right away. Now, we need to know a little bit about the Norwood scale. And the Norwood scale is the leading classification system is used to measure the extent of male pattern baldness. It's almost like a tool or a process that they go through to see how this male pattern baldness will develop or deteriorate, either or. But typically, men lose their hair in one of several common patterns over the course of many decades. And see, this Norwood scale provides an easy reference. It's easy reference. It's an easy reference, and it uses images that indicate different stages of balding, and that's really what it is. And there are other classification scales used by doctors. However, this is one of the more common, but there are scales for both men and women that focus on pattern baldness, and this Norwood scale is basically the measurement that's most commonly used among clinicians, especially when you're talking about male pattern baldness, right? So this provides a reference point to diagnose the extent of baldness, and it allows you to discuss treatment options and measure the effectiveness of the treatment. So basically, if a doctor does give you some medication or make some recommendations, This whole Norwood um, scale, it's what it's going to do is give you a place where you can see if the treatment's working, right? It's almost like a frame of reference. So there are 7 stages to the Norwood scale. Well, really, it's called the Hamilton Norwood scale, but a lot of people just call it the Norwood scale. And there are stages to this. And one of the stages is stage one is there are no significant hair loss present, or there's no recession of the hairline. That's in the first stage. Second stage is there's a slight recession of the hairline around your temples, known as an adult or mature hairline. And the third stage is there are signs of clinically significant balding, which appear, and the hairline becomes deeply recessed at both temples, resembling an M or a U or V shape, right? And these recessed spots are completely bare or sparsely covered in hair. And then you have the third stage, which is known as the vertex. And this hairline stays at stage 2 for a while, but there is significant hair loss on the top of the scalp. And that's why it's called the vertex, right? And their stage 4 basically is the hairline recession is more severe than in stage 2, and there is sparse hair or there's basically no hair on the vertex. You ever see those dudes with that little bit of hair on top, and you're like, why don't you just shave that little thing off? Well, that's, I don't know, they're attached to it, I don't know. But these are areas. The 2 areas of the hair loss are separated by a band of hair that connects to the hair remaining on the sides of the scalp, right? There's those 2 bands of hair. That's stage 4, right? It's more severe than in stage 2. But stage 5, these 2 areas of hair loss are larger than in stage 4. They are still separated, but the band of hair between them is narrower and sparser. Stage 7 is the most severe stage of hair loss. Only a band of hair going around the sides of the head remains. The hair is usually not dense and it may be fine, whatever is there. So there is a class system, and the Norwood Class A is a variation of the Norwood scale, is a slightly different and less common progression of hair loss. Well, you do need to know that it sounds complex, but it's really just a scale, and usually you got the image, and the doctor or the clinician will have an image, and it'll easily, you'll see through these images how it naturally progresses and the hairline deteriorates back. It's quite revealing. Now, we talked about some of the treatments, but there are, besides a hair transplantation, right, parts of the scalp that have good hair are removed and transplanted into the bald area. That's one thing, but there's also scalp reduction. And that some of the bald scalp is surgically removed, and the parts of the scalp with good hair growth are brought closer together. And this could be combined with a hair transplant. And there's also scalp extension. Devices are inserted under the scalp for about 3 to 4 weeks to stretch the skin. And this procedure may be done before a scalp reduction or a standalone treatment. And then you have the scalp micropigmentation. And you've seen it, tiny tattoos can be applied to the scalp to create the appearance of a shaved head. That's becoming more common, especially in the United States. Well, we've covered some really good information here today in regards to male pattern baldness. And I think that what we're going to do is part 2, we're going to cover female pattern baldness, and we're going to discuss that as well. There are some differences, a few differences, but I think it's important that we cover it because this is what people have to deal with. And it's important for them to understand and educate and understand that they do have options. So I want to say thank you to my listeners and be like the wise old bird and spread the word. Okay, take care of yourself.